Today we have Jasmine Teachout and very exciting company called Motivated and Moving. So very, very exciting. This is something the world needs in the home care space, especially with insurance getting tougher these days. So Jasmine, I'll ask you about that is tell me a little bit about yourself.
Thank you, Tom. Sure. Again, like you said, I'm Jasmine Teachout. I'm the founder of Motivated and Moving. I am a licensed physical therapist assistant and spent multiple years in a clinical setting. And thankfully, I was able to listen to the senior client specifically and develop this exactly for them, for their needs.
Perfect. Great. So, tell me a little bit about what you do.
Sure. So Tom, at Motivated and Moving, we bridge the gap between formal services and maintaining their functional abilities. So in the event that, for example, they've been discharged from their skilled care, we are able to help them from an education and experience standpoint to maintain their functional abilities, allowing them to stay safe wherever it is that they call home. And then maybe when their insurance is effective again, or when they return to their primary and get reauthorization, encourage them to join the formal services again. In the event that maybe they're in an auto accident or there's a wait list for their services, we bridge that gap there as well.
Yeah, that's awesome. So I know that's always one problem, like as a physician, going to people's homes, physical therapy sometimes takes them a long time to get started. Or number two, it runs out in a couple of weeks and they show up maybe once or twice. So how do you work with scenarios like that?
Great question. It's our forte. We love to be connected, anything we can do to help. So how do we work with that? We are just there to hold them accountable. Oftentimes they're discharged and it takes a little while for them to be in touch with their formal services. They're overwhelmed. So we come there and help direct them. In the event that they are waiting, we bridge that gap there as well.
Perfect. Yeah, that's awesome. Jasmine, should physical therapists be scared of you since you don't take insurance? Are you out to get their clients?
Tom, absolutely not. We work together. We are in this to help each other and our vulnerable population. So how do we work together? As mentioned, we work based on their needs. So in the event that they're waitlisted, we have referrals from physical therapy to bridge the gap until they're able to get on the formal services side. And in the event that the therapist feels that they have actually met their functional objective goals, but could still use that little accountability, we come in and work with them for the long term and allow them to maintain their functional abilities.
Yeah, that's awesome. Mm-hmm. And that's something that's very well needed, because insurance just doesn't cover enough stuff these days, Especially my patients, like a couple weeks will not do it a couple times a week, It's really a lifestyle change. And I know Jasmine, what she's doing is every single year, this will be more cost effective as insurance and reimbursement continues to come down. Jasmine, how do you help people that are coming out of the hospital that need physical therapy?
Great question. We love to help with that. Oftentimes, families are overwhelmed. So in the situation, we are connected with a lot of the social workers that are in the hospitals, and we discharge planning, and we work with them. Oftentimes, they are given our flyers or information and educated on contacting us. We help them if they have a script for formal services, help them get connected, and then in the event that they're waitlisted, we bridge the gap there as well. But straight out of discharge from the hospital, we are involved in advocating for the seniors.
Jasmine, how can you help physical therapy offices do what they do or complement them?
We can work together as we always do in the clinical setting. So, like I said, when the clients are discharged from when the patients are discharged from the formal services, the therapist has had an opportunity to get to know them and their needs and what the lifestyle is like at home, whether they're being discharged at an independent level in their home, or if they have family involved. And we can help bridge that gap, like I said. So transportation is difficult. We live in the beautiful state of Michigan, so winters are long. Families have a difficult time transporting them in the event that it's not home health care, physical therapy. So we work to bridge that gap additionally. And we refer back to therapy in the event that maybe their insurance is reactivated or something along those lines, or feel like they're making good progress and would be better in a formal setting.
Jasmine, how do people go about getting extra physical therapy when their insurance runs out?
There is not an answer to that other than our services. There is private PT as an option, and I strongly encourage that. And I recommend that, and I have strong referral sources, and in the event that we do not cover that service area, I will recommend them elsewhere. But our services are extremely affordable. As I said, it's education and experience background, and with that being said, I happen to have an advantage of knowing what outpatient therapy copays are, as well as the private PT, and we make it affordable.
So Jasmine, the big question is that everybody's wondering, if insurance doesn't cover the home physical therapy, how do they pay for it?
Amazing question. It's affordable. It is private pay. It is an out-of-pocket expense, but it is extremely affordable. We have put a lot of thought into this portion naturally, because it is typically expensive, but we make it extremely affordable. So our services are extremely affordable. They have been thought about for a multitude of years. We know what outpatient therapy costs, and we're not competing with that at all, but we wanted to make them affordable because there's such a need for this with the seniors and the vulnerable population. So it does vary based on each individual needs. I will mention this, we do not require any contract or commitment for our services, so it's all very unique and catered to each individual. So with that being said, we offer a no charge first assessment, and after that first assessment, we decide what our calendar is like moving forward and the cost associated with it.
Yeah, and I'll tell you, copays are so high right now. I know for like specialists in the state of Michigan, it's at least like $40 on most plans. So I imagine like once you start getting into those volumes, like per visit, it's probably not that much different. That's what people don't realize about insurance is what's covered is not really covered. You're gonna pay on the front end or the back end. That money is coming out from somewhere. And I know like people who do it privately, like Jasmine, the overall cost, with insurance, you're paying it somewhere. Either your employer's paying it, or through private insurance, you're paying it, or through taxes, you're paying it. With private services like this, the overall cost is significantly lower. It just depends where it's coming from, but just be aware of that. What services do you provide with Motivated and Moving?
Motivated and Moving provides services related to whole body health and wellness. So although my background in education and experience is physical therapy, we work on 6 dimensions of health and wellness, so not just the physical component. It's pretty funny that sometimes in the senior communities and the seniors alike and everybody, when they think of exercising and activity, it's a red flag. So we've divert our attention and focus on it a different way from an educational and experience side of things, and tie it into something fun related to a former hobby or anything they did in the past. So each of our sessions is related to physical as a large component of it, but social, emotional, spiritual, intellectual, and environmental health and well-being.
Yeah, and that's phenomenal because from an insurance standpoint, you're going to get like a 15-minute visit. As great as skilled nursing visits are, whether you're getting physical therapy, occupational therapy, a case manager, these are meant to be short, intermittent visits, is the official definition in insurance verbiage. That means you're getting like 15-minute visits a couple times a week. Someone like Jasmine can actually pay attention to all that extra stuff and really provide the care that most people probably need but is not covered. So you really have to think about the quality you're getting over, the fact that it's just covered.
And I will piggyback off of that. We actually schedule each of our sessions for 1 hour. We do not exceed 1 hour for a multitude of different reasons, but 1 hour is what we schedule our sessions for. And sometimes they don't take an hour, but that's what we schedule for, so we do a lot that amount of time.
Are you able to give people advice on like what they should do when they're at home? Because I know a lot of people don't understand the insurance system and they're overwhelmed. So from like an advocate standpoint, tell me a little bit about that.
Absolutely. So I am learning a lot myself, and I especially am able to advocate for them because I know what's available to them and what should be available to them, and I am able to help them address red flags. So absolutely. With that being said, we do offer that as part of our services. I just like to help and see everybody experience a quality of life, high quality of life.
Please subscribe if this helped, and if you want to learn more about assisted enhanced home care or joining point professionals, click on the show notes or click on videos for more.